When you join, please mute yourself and unmute when you have to ask questions. There are no questions sent in before, because today's session is kind of what me and Vaibhav decided like 45 to an hour back. Um, Not such great news, but we have two cases which we have seen today. One from our own group over here of Anmol, and and he had posted this question sometime back. But long story short is, we thought that it would be essential to reinforce for each and every dear member of our platform, OMPEG, and the extended one, to be take all the precautions possible in this time, because what we heard today and what we kind of gathered, Vaibhav shared one case with me, is something which at least tells us that it's better to, prevention is better than cure. And forget the cure part, we don't want to go to that level where the diagnosis happens and we are in critical care. So without saying much, I think so I'll give it to Vaibhav, who will fill in with what the cases were and what precautions. The focus of this call is more on the precautions of what we should take. While everybody knows it, we are still reinforcing it, so that we want to see everybody safe and sound. So, Vaibhav, you can get started, please. Thank you.
Yes, thank you. So basically, today's session is more about like a revision sort of session. So we'll be going through again. Although I think if somebody asks you about coronavirus, you will be able to write long essay about it. But I still want to reinforce and emphasize about the signs, symptoms, the investigations, and the treatment part, little bit of it, and specifically on the precaution side, because we have one of our colleagues, as a doctor colleague, who was quite unwell, and there was another one of our friends as well, who recently had the symptoms. So we'll be doing this as a like kind of case based discussion. Obviously, it is we're trying to keep it as anonymized, rather than disclosing the any person identification. So we have a young guy who he's. So I'll tell you about first of regarding one of my friends' case, and then we'll discuss about our other friend's case. So he's a young chap. He's in his early 40s. He works in a healthcare profession as well, in where you see the COVID-19 patient quite frequently. So he's been seeing the patient for last 3 weeks and was not feeling well for almost like 10 days. Was feeling like generalized weakness, lethargy. Initially thought it just too much of stress. That's why having the symptoms. But then afterwards started with low grade fever. And then initially for 2 3 days it was low grade, followed by it was a proper high grade fever, about 38 plus, and with chills, rigors, and backache as well. But he initially went to one of the other A&E as well. But as usual, they advised to stay at home. If cough, cold get worse, then come back. So although himself is at a consultant level as well, but still like it's same for everybody.
So, Vaibhav, you want to tell them that he himself is a doctor too,
Yes, he is a
just to
himself.
specify.
He is a himself is a doctor, and he is a specialist doctor in respiratory medicine. So I will emphasize that again. He is a specialist in respiratory medicine, so he knows stuff in and out. So he himself is an expert, but he still developed the symptoms, and obviously you can't avoid that. Of like you cannot, as a frontliner, you are always at the risk of getting infection. But then he had the symptoms of fever last couple of days. So we spoke 2 days ago, and I told him like your symptoms are getting worse, your cough is getting worse, same with your shortness of breath as well. So although you are expert, but need to go and do further things. But he was like, okay, let's see, as a casual approach. Although the shortness of breath was getting worse, but sometimes it's difficult to say like whether you need to know your baseline, and you have to have an unbiased opinion, because the moment you start treating yourself, or the moment you start seeing that person as your friend or relative, or close family member, then there is an element of bias can kick in. It may be good bias or it may be bad, so it depends. So in his case he decided to stay at home, not to worry. His symptoms started worsening. So today, still yesterday, he was having the same symptoms. Then he took regular like paracetamol, and in the morning he called like, I'm feeling well, so wanted to come back to work because it's too much work to do. So hospital guys said, okay, fine, if you're feeling better, if you're not having any symptoms, you want to come back, you can come back. And then he came, and the moment he entered into the ward, he collapsed. So what we called as a cytokine storm, or what we called as myocarditis, like there is a myocarditis, the inflammation of the heart. So that kind of a thing happened with him. Obviously the resuscitation team was there, and he went through all the resuscitation and he survived. But the moral of the story is anybody can get this illness, and you need to, so we know the signs and symptoms, so you need to listen to the experts. Even if you're expert, you need to, when if you're ill, you need to keep that bias aside, so you need to listen to other experts. So at that time you are ill, so you can't say that I know the stuff, so I'm going to follow that only. Obviously your knowledge is there, but if you're ill, you need to listen to other people as well. So that was one more thing. So then,
So you want to
after,
state the precautions, Vaibhav,
yeah.
after,
So
so that
the
that is what is
symptoms are,
important. They should understand.
yeah,
So
yes. So the symptoms, again, like to emphasize, the symptoms can, it can be initial presentation, can be anything. It can be presenting with a diarrhea. It might be just a dry cough, a headache, vomiting, shortness of breath, sore throat, chest pain, conjunctivitis in very rare cases, abdominal pain. Appendicitis can also present like this as well. Like you can get appendicitis as well, like those young population. We have seen a lot of patients recently. So those are where the symptoms, and when the doctor sees you, then they can check your oxygen level, heart rate, blood pressure, respiratory pattern, and they will advise you whether to stay at home or come back if you are unwell. So the key thing is, although we have been constantly told by the Public Health England and same in other countries as well, that if you have a fever and cough, stay at home, but also note that they have specifically mentioned, if your condition deteriorates, if you are not feeling safe, if your symptoms are getting worse, please, please, please kindly go back. If you do not do that, then you're gonna succumb. If the symptoms are, so I'm not scaring you, but you need to understand that if your shortness of breath is getting worse, so getting worse means like on a normal day you are able to walk 1 mile, but obviously now you cannot go outside the house. But even if you're going from one room to another, or even if in walking within a room, if you're becoming, if you're catching your breath, your, if your breathing pattern is becoming erratic and you started breathing too fast, in that case you need to go to your healthcare provider. You need to call again 111, or wherever, whichever country you are in, you need to contact your healthcare provider and need to take their advice and guidance. Please, if your symptoms are worsening, do not just stay at home. Please go and see your doctor or healthcare professional regarding the symptoms. So say for example, if somebody has all the symptoms and he has a travel history from any foreign country where they had the symptoms, or even within the UK, like he come in contact with the COVID-19 patient, now this guy is COVID-19 positive, what's next? So next plan is two. They will either keep you in a hospital, or they will say like, go back home. If they're keeping in hospital, I'm not going to discuss about it because they will look after you, so that's the end of the story. If
yes,
you are going back home, then you need to do the quarantine as a strict quarantine. Strict quarantine means you are not going outside the house. You are not going into the Tesco market when you know that you are COVID-19 positive. So it will, first of all, prevent the spread of infection to others. And second thing, you yourself are not going to put at risk of getting other few more infection on top of COVID-19. So F word, stay at home. Don't use your brains excessively. Like, I'll go outside, I'll do the jogging for 5 miles, and I'll go for cycling in the morning at 4 o'clock or in the evening at 7 o'clock. Please don't do that. Stay at your home, get inside your master bedroom if you have one, and stay at home, and then take care of yourself and monitor your routine stuff. Eat healthy, and try not to go outside doing excessive stuff. So regarding the home quarantine, so those people, again, the home quarantine can be further classified into two different types. So those people who have a benefit of having multiple rooms in their house, where they have a master bedroom, and they have they in the master bedroom you can modify your master bedroom by putting microwave in it and a few more stuff in it, like mini fridge, something like that. So that will be your separate, like, single room inside your house, where you do not need to come out from that room for a couple of days, like at least for 2 weeks or till your symptoms are settled down. And in a second scenario, if you have a limited number of rooms, say for example, if you're living like 2 room or 3 room house, in that case, obviously you will not have that luxury of segregating yourself from rest of the family members. But then you need to make sure whenever you're coughing, you're using the tissue, and then you are discarding that tissue in a safe plastic bag, which will be tied again and then will be discarded appropriately. You're not coughing on people's face. You are eating healthy. Then obviously there are no specific scientific papers regarding the salt water gargles or lukewarm water and high concentrated salt, putting into that and then doing a high concentrated solution and gargling, but that helps up to certain extent. So then it's an individual choice, but personally I would recommend to do that. That will help to soothe your throat. Regarding the steam inhalation as well, it has its own, you need to make sure you're not having getting any scald, so you need to have the proper temperature. So when you're taking the steam inhalation, it has to be appropriate as well. You need to take regular paracetamol as per your age. So those guys who are less than 18-year old, with like between 5 to 12, so they will be as per the age, the doses will vary. For the adult people, they can have 1 gram of paracetamol. So normally you get a paracetamol of 500 milligram tablets. So you can have two tablets 4 times a day. That will help to control the temperature. If you are in other countries, then you need to follow your different policies as per the country. In India, they will be treating you differently, like regarding the chloroquine and other antibiotics. I'm not going to go into the treatment plans because it varies from country to country and as per the local policies. But I need to emphasize again that you need to strictly follow the quarantine stuff. So quarantine means you need to be like, you might feel like as if it's a prison, but you need to adopt and you need to modify your lifestyle in that way, that in your separate room you can have your iPad or something, whatever you want, just so that you're not getting bored. You can watch TV serials or whatever, but at the same time you need to make sure that you're not going out quite oftenly. Why I'm repeating it again and again and again, like I think I'm saying this like third or fourth time, because still, like many of our colleagues and friends, even if they're on this group or they're listening to the stuff everywhere, they still keep on going on jogging. You say like safe distance, but they will, because they're friends, they will walk together and they will go together, walk for commonly, like. But that's, you're gonna spread. We have discussed it earlier as well. If the other guy is having infection, you will not know that unless until he becomes symptomatic, but you might catch the infection from him, and same, like vice versa as well.
Yeah.
And
So where we just, let me jump in. So the bottom line is, we know that everybody's taking care, but please take utmost care in not leaving the house. Like, I've decided to order groceries online. I'm not leaving my house at all. I used to take a drive in the evening, but that also is kept optional now. The only reason we are saying that, we are reinforcing the things which everybody is doing and everybody knows, but just don't leave your houses and don't take any chances, because what we saw and what we discussed between Vaibhav and me today, is not worth enough to take chances and end up in a situation where two of our friends have ended up today. So that's the only thing we wanted to reinforce. In which ways, you want to, before getting into the other case, whether you want to open it for questions so that people can ask questions and then we can go on to the next case.
yeah, yeah, so the in yes, Rahul.
Yes, sorry, just question on the symptoms, because that's a little bit gray area. It's always
Yes, yes, it
he
is
always
again.
gets confused between the the normal symptoms for and the COVID symptoms. So if you're building mucus, but there's no cough, there's no fever, do you see that mucus is getting built up and you feel a little bit congestion? Is that something we need to worry about? I mean, or it could be just normal thing.
So the what they say is, sorry, Rahul. I'm gonna put you on mute because it's causing echo. Hello, can you hear me?
Go ahead, Vaibhav.
Yeah,
Yeah, go ahead, go ahead.
yeah. So what they say is you need to know common as well as rare symptoms for the common disorders, and you should know the common symptoms of rare disorders. So in simple words, this COVID-19 can present like anything. Any of the symptoms can be COVID-19. It's difficult to say whether it's related with the COVID-19 or is it a normal. It is even in the like clinically we have seen so many of the patients, they are coming with a different symptoms, but clinically it will be a challenging to differentiate whether it's a COVID-19 or not. So to say whether if you're having a dry cough whether you can have a COVID-19, or if you're having a mucoid cough where you're actually producing a lot of phlegm, then you can have a COVID-19. So in theoretically, in ideal situation at the beginning it has to be dry cough, but when you are having a dry cough, if your immunity goes down and you started developing secondary bacterial infection, then you will start producing mucus as well. So the cough can be dry, it can be mucousy as well. In most of the cases it will be dry, but if you have a mucousy cough it cannot rule out the COVID-19.
But primarily, you're saying cough with fever and shortness of breath are the symptoms. If you're having that,
Mhm.
that is something which you need to go and get tested right away, right?
Yeah,
Without,
so
yeah.
if your symptoms are getting worse, if you're having shortness of breath which is worsening, you need to contact a healthcare provider.
Uh, Weber, on this topic, I think same symptoms is a big thing because nowadays with the change in weather, you always have cold, running nose,
Yeah, yeah.
cough. Not like a continuous cough, but you generate something in the throat, which is sort of an infection. But if you are doing everything fine, just like in the house, and we are not leaving the house as well now.
Mhm.
So, do we need to like monitor before taking into the little cautious kind of thing before calling doctors, or you think it's just best way to just give a call and go for a checkup?
Means sorry, I didn't get your question.
No, because we are in the house now, so we don't leave the house.
Yeah,
We are there in the house from last 10 days,
yeah.
so we're not having any like external things. But now within last 2 3 days, we have continuous running nose and then sore throat. Uh, is it something isn't we need to check as well, or just
So
monitor and observe any
so
change in the
So when the symptoms are minute, they advise to monitor at home,
yeah.
because the people who are in the hospital, they will be more unwell. Those who are admitted in the hospital, so they do what we call as like risk stratification, and they decide whether who needs to get admitted and who need to go home. Or even if you're unwell, but you're not critically unwell that needs an admission, so they will ask to go back home and look after yourself. If your symptoms are worsening, then coming back. So for the minor symptoms, they're not gonna give you any specific treatment for that.
Yeah.
So in that case, even if you go there, they will just say like, go back, we're not gonna do anything more, unless until there is a change in the policies where you can have a mass screening. So the
Mhm.
screenings can be done by different ways. including chest X-rays, a blood
Mm-hmm.
test, swab test, which we all know that there is so much of things going on. But there will be a lot of new things coming in next 1 week time. Not just an antigen test, but few more things. I'll keep you updating about it.
No,
Like
that will be good.
yeah, so there are gonna be a couple of like mass screenings down the line. They're coming, but
Okay.
depending upon which area you are in, which country you are in,
Mm-hmm.
those will vary.
Okay. So
Yeah,
we have
but the key thing
UK.
is, if you are having a less number of symptoms, then stay at home. The only when the key thing is, whenever the shortness of breath is getting worse
Mm.
and the cough bouts are getting worse. So say for example, if you're having three bouts of cough in a span of 1 hour, but now that has gone from 3 to 10. So that means you have, from your baseline, you have gone,
Developing more there.
yeah, more symptoms. So there's a downtrend is there. So
Mm.
in that case, you need to contact your doctor.
Okay.
If you're vomiting, like normally you're vomiting twice a day, but you started vomiting 10 times a day, then obviously the vomiting itself
Change the
can
okay.
cause the dehydration.
Yeah. Okay.
So
So your suggestion is observe for a couple of days and see whether symptoms are increasing, and then
yeah,
take a judgmental call based on individual
yeah,
uh, how the physical body is reacting. Because
yeah.
on NHS thing, there are two guidelines which is given very clearly. One is a high fever or dry cough for more than 1 hour or continuous. If those are the two, then they say you just call the 111 and
Yeah,
then
so
follow the
they
step
have
of
their own questionnaires. They will ask you a list of questions,
yeah.
and then eventually they will decide. Or they do what is called as triage, and
Mm.
they decide what should be best for what
Okay.
will be best for you. But
Yeah.
if you notice that the shortness of breath is getting worse, that means the infection is going down to the chest,
Yeah.
and then that means you might need further assessments.
Okay.
So yeah.
Yeah.
Why about sometimes triple one takes more than an hour and still they don't respond? Because last time when I had a chest pain, I had to literally call 999 after that. Because
Mhm.
what triple one they put me on the music for almost 1 hour,
Yes, yes.
$5 per day.
There is a
No,
huge.
it's very horrible nowadays. It's very difficult. So
Yeah,
they
yeah.
created, I think, the online appointment system now. So
Mm-hmm.
yeah,
So there is a huge, like, because you
yeah,
can imagine so many
yeah,
people are calling and they have limited number of resources. Although they are expanding it, but still, like some of the calls might last for 2 minutes, some of them might last for 10 minutes, or
yeah,
maybe more than that.
yeah.
So,
Just last one, Weber, on this series.
mhm,
So there was a one of my friend in India was he's a doctor. He was suggesting maybe just to do a quick check. Maybe I can
mhm,
create a more. So just inhale early morning when you get up. You inhale and hold the breath for a certain time, depending on your capacity, and just
mhm,
keep observing whether it is still functioning in the same way. Is
mhm.
it? Do you think it's a good idea to observe whether your lungs are
So
still in the same capacity?
that is a subjective one.
Yeah.
And also there was one of the, I've seen somebody was posting the similar sort of video on WhatsApp as well.
Yeah,
But
Okay.
it's doing the rounds today. 10 seconds of.
yes,
Yeah.
he mentioned that if
30
you're,
seconds.
yeah,
10 seconds is very small.
so he mentioned that if you are able to hold it, then you're not going to get corona. So that
No,
is
just
wrong.
checking the lungs capacities are not getting
Lung
worse.
capacity is like you can intake like how much the breath you are able to hold, and then try. So main thing is if you start doing deep breathing exercises,
Hmm.
that helps to improve your lungs strength.
Hmm.
So
Okay.
like what we, it's the same stuff what we call as pranayama,
Yeah,
and
I do it regularly.
yeah, so
So,
but then you need to do it properly. Then,
yeah.
but any deep breathing exercises helps to improve the strength of the lungs, and that is the same concept is used for the spirometer and other stuff as well. Like where they ask to blow through that, and then they ask to stop, and then again try to take a deep breath into it, so that increases the capacity of the lung.
Yeah.
But that need to be done by normal people. If you have a previous history of pneumothorax. Pneumothorax means ruptured lung, spontaneous ruptured lung.
Hmm.
Then, or those people who are on COPD, so they has to be done with an expert advice earlier. Those
Oh yeah.
people who had the normal lungs, then that's a different story. But if you have the previous spontaneous pneumothorax and you start doing fancy stuff, that might not be a good idea.
No, that's a good suggestion, Vaibhav.
Okay.
Thanks.
Hmm.
Thank you very much. I think it's really
Sure.
helpful.
Yeah.
Yeah, Vaibhav, just before we get into the next one, Ani had a suggestion about Amrish. So, Ani, do you do you see him on this call right now? Does he have any questions, or is he just to understand uh, the discussion part of what we're doing right now?
I don't know. Whether it's
I think
still.
so. Yeah, that's fine. Just
Ani,
get.
Ani's
I'm
saying
on mute.
I'm on mute. Right. I don't know how to unmute it.
Even I tried it yesterday. Could not unmute him for some reason.
Mute.
Challenge.
No.
You are the moderator, so you should have control on.
No, no, that's the
No.
problem. We could
No.
not do
See.
it yesterday.
Yeah.
It's okay. Carry
Uh,
on, please. Okay, he's saying carry on. Let's carry on. Okay, that's fine.
I have a question, Vaibhav.
Yeah, hi, Nikhil. How are
For a
you?
mild symptoms, yeah, I'm good. How are you?
Yeah, good. Yeah.
Uh, for mild symptoms, um, in NHS, if somebody walks into NHS, let's say if I go tomorrow, and
Mhm.
will they take the blood test or blood test and chest, or they just do some normal triage? Rather calling me on 111 if I just walk in into A&E.
Mhm.
So what will they do?
So, in A&E, what happens is initially you go at the front desk. So, depending upon like different A&Es have different policies, but most of the time, some of the A&Es, what they do is we have at the desk where you get booked in for the normal checkup. They do a rapid
Yeah.
triage. They will ask you a set number of questions. Depending upon the number of questions, what the symptoms you're having, they will distribute in different zones, whether you are for the green category, whether you are for the amber category, or you are for the red category. Green category, so this is something new. So green category means you are having a non-COVID symptoms. So any other symptoms like having sprain in the leg, but it's not COVID-19, not classical COVID-19, or having laceration or wounds on the hand. So those are non-COVID-19 symptoms. So they will be channelized to green one. Those patients who have classical COVID-19 symptom like having significant amount of fever, cough, shortness of breath, travel history, other comorbidities like diabetes, hypertension, asthma, and they're literally like too short of breath and they have this classical symptoms. Then they will segregate those people and move them to the red zone. So in the red zone, there is complete COVID-19 protocol is followed in red zone. So like complete PPE and everything. So you will be diverted into red zone. Those people who have symptoms which are not classical of COVID-19, but at the same time they are not simple questions as well, like not simple straightforward thing. So you are overlapping. So those guys goes to the amber zone. So once you go to the amber zone, then one of the nurses will do a triage. So what they do is they ask you the similar, like since when you have the questions, like similar questions, since how long you're having symptoms and etc. And then after that, they will ask you about whether you had any other, other than that, any other classical symptoms, and they will do your basic parameters such as heart rate, blood pressure, temperature, and then according to that, they will decide whether what need to be done for you.
Okay. So this heart rate things, can we like many of us is having the smartwatches. On that you can measure the heart rate. Will that be sufficient enough to monitor the heart rate or not?
Yeah, but it's not just on heart rate. They do clinically assess you in terms of listening to the chest, whether you are wheezy or not. Unless until there is a
Okay.
family member who is a doctor and who can assist you at home, you cannot do the triage on your own at home.
Okay.
Yeah,
Okay.
yeah.
Okay.
So,
Yeah.
so that and then after the triage, if they think his guy is wheezy, need a nebulization, then they will ask the junior doctor to listen to your chest. If you have any chest pain symptoms, whether to do an ECG. So one can say like there is a new technology where you can actually see the chest lead on the Apple iPhone as well. So if you put your two fingers, you can see a ECG. But that's not a classical 12-lead ECG.
Mm-hmm.
So doing the bloods again, it's a subjective one. So based on your clinical symptoms and clinical judgment by the initially by the nurse followed by the doctor, they will decide which blood test you need.
Okay, okay.
Yeah.
So usually blood test will confirm the COVID-19
Sorry.
100%. I mean, when they take a blood test, the blood test reports confirms the COVID-19, right? The
So
best on the chest. So
so
what is the what decides COVID-19? Is blood
so the
test or chest X-ray
uh
or
so it's a combination of everything. See, you need a clinical diagnosis. On the
Mhm,
bloods there are certain certain counts, so you can see the, say for example, there is something called as lymphocyte count. So that means your white cell count. So there's a body defense cells, so that number can go down. So if your symptoms are too bad, the count will significantly down, less than the normal of 50%. Initially it may be same as your normal range, but if your symptoms are worsening, then that count will be on a downside. Then the gold standard, they says, is doing a PCR test. So PCR test is taking a swab from the posterior part of your throat and sending that swab for the virus culture. But that swab results can take anywhere between 12 hours to 7 days, depending upon which hospital you are going, what facilities they have, and
mhm,
how they are processing that sample. But even if you do the RT-PCR test, like the swab test, if the swab test is negative, that does not mean you do not have a COVID-19. You can still have a COVID-19, but you are in that incubation period where the symptoms are not completely full-blown developed, and the test is still not in adequate quantity to give the results. And there is again subjective variation, like that sample need to be taken properly. If the swab is not taken properly, because you cough or because of any reason, and then it was not taken properly, then it will give an inadequate sample. So there are technical bits involved into it. So chest X-ray can diagnose changes which are related to the COVID-19. It has its own sensitivity and specificity, and there is a sub, like again subject bias as well. Like who is looking at the chest X-ray? There is a, again, like inter-observer variations are there as well. But if you have a classic symptoms, like if you are that unwell, then obviously it will get on the chest X-ray. But you will have other parameters as well. Your blood results will be bad as well, and clinically you will not be able to sit and speak. You will be short of breath also. So clinically, like in all parameters, you are hitting the lottery in terms of everything is bad basically. But then that's a clinical picture. Then they will ask to admit those kind of people. So it is a combination of everything, like any other illness. So there are very very few illnesses where you can do spot diagnosis just looking at that XYZ thing and saying, okay, this person is having this disease. But it's more like a combination of a lot of things.
okay, okay. Yeah. Thanks,
Yeah.
thanks, Vaibhav.
Santosh,
And
Yeah.
just now you have mentioned that the government is thinking for mass testing of COVID-19.
Mhm.
Uh, so probably if you have little information,
So,
can you?
so not our government in UK, but in some other countries.
Okay, so in UK they are not testing people in the
So
mass.
they're just doing it as a routine practice. Those who are unwell, that they will get the test. Not everyone, because
Okay.
it's same like uh, how shall I put it? Uh, so it's like they there is a cupboard full of nappies. So those people who have children, they will get the nappies. Not everyone. And if you have a children, those who are have a bladder incontinence, they will get a preference over the other people. So like that. So when you have limited resources,
Mm-hmm.
uh, it will be the one who are at risk. They should get done first. In ideal world, blanket screening for everybody. but that's not practical and feasible in certain. So that is called as epidemic, that the resource capacity is limited, and then the demand is too much, so it goes beyond the capacity to handle it. So then they do risk stratify, who needs first, they will get it when you have limited resources. And even that there is a
Okay.
capacity of expanding it, but there is a limitation on that. And even if you get diagnosed, what you're going to do, you're going to quarantine yourself. So even if you have a minimum symptoms, what is the end of it? The end is you need to go home and quarantine yourself. If the
Now,
symptoms are less, if symptoms are
Mhm.
worse, they're going to admit you. So just being scared or worried about whether I'm not going to get a test is not going to make any difference. If you're clinically unwell, they will admit you. If you're clinically well enough, they will send you home.
But in that
So
case, do they give any medicines?
not in UK.
So for those who've been detected with the mild symptoms,
They
NHS
go
is not
home
at
with
all giving
paracetamol. They need to buy
just
paracetamol from Tesco.
okay.
Or not Tesco. I'm not promoting Tesco. Any Tesco, Waldi, whatever. Yeah.
Yeah, I mean
yeah,
anywhere you can say just a paracetamol.
Yeah. Just a paracetamol. So we are not following any specific policy of any antibacterial or any antiviral, because as per the Public Health England, they did not found yet any specific correlation of any specific medication to see the better outcome as such.
Hmm.
Vaibhav,
But in
yeah,
other countries, they do following different things like chloroquine and a lot of other stuff, immunomodulators.
can I come in now, Vaibhav? This is
Mhm.
Ani. I
Oh,
was.
hi Annie, finally.
No, that's okay. I managed to unmute myself. I was trying to
Good.
press the small pin. So sorry.
Yeah.
I just waited while you finished the first part. So I'm asking this question on behalf of Amrish, who's a friend, a big member, and he's just joined on the call. So he can't unmute himself, but that's fine.
Mhm.
So
Mhm.
he's locked himself in now. He's in self isolation. He's
Mhm.
got dry cough since Saturday, but that's constant cough that he's experiencing, which I think we've discussed. But he's noticed a white spot on his throat, which he checked with his mobile camera and light at home.
Mhm.
So there's constant itch, and that's he's constantly coughing. So he just wanted to know about it. So he does little bit of warm water gargling, then it stops, but it's
Mhm.
there, and he's seen the spot like a little pus spot on the throat.
Mhm.
So that's all. I mean, I'm just sharing what he shared. So have you
Right.
seen anything like? I mean, it's
So
a very
basically,
specific.
when we have what we call as follicular tonsillitis, so that is like when you have the inflammation of the tonsils,
Mm-hmm.
there is a bacterial infection. Then so that having the white spots on the tonsils may be because of many reasons. So in the children, it will be like if they have had a breast milk and after feeding, then they can get white spots. In adults, if they are having any bacterial infection of the tonsils, they can get that kind of thing. If there are any food particles stuff, that can also get in diphtheria, we get a whole white membrane all across the backside of the throat, not just one spot. So we do get tonsillitis quite commonly, but that not necessarily has to be COVID. It is just a plain normal bacterial tonsillitis can give the white pus like
Okay.
or white stuff on the backside of the throat. And
Okay.
in normal tonsillitis, then the symptoms will be same like cough, because the tonsils are swollen, red, inflamed. So it will cause the irritation of the throat. So that can cause the cough. So there will be the cough, there will be the fever, and there might be plus minus runny nose as well. So it
Okay.
is quite tricky. Like
Okay.
But but
So simple medicine like Panadol or something can help, isn't it?
yeah, that will help. Yeah.
Okay, because he's having constant cough and he's locked himself in, of course, because he's got a baby and wife at home. So he's just gone in
Right, because
self
if you
isolation.
have a so on that note, so if somebody is having tonsillitis, they might, so if the
But
tonsillitis
he doesn't know that. So he just
oh
noticed constant cough. This is nothing about tons. I mean, he just, since yesterday, he's having constant cough.
mhm,
Almost, there's no gap in that. So
mhm,
suspecting that and sore throat, which were the first published symptoms, he just decided to self isolate.
self-isolate.
Yeah,
Okay.
that's
What we'll do is like obviously you need to take regular
of
paracetamol
course.
four
Yeah, yeah.
times a day, and then till the time 111 if required.
Thank
But
you.
we can do, like I was offering this to one of the other our colleague friend as well, something what we call as FaceTime, like a WhatsApp video call. So obviously that's not in the ideal
No, no,
way,
no.
but at least it is better of not having anything. So just to see, like I'm not examining it
Of
as a
course, yes.
physical examination, but that might just as a kind of triage sort of thing to help to see whether
Wow.
yeah, probably that
So
might
kind
help.
of, yeah.
Yeah,
yeah, he's of course listening. So thank you so
yeah.
much
So
for this. Yeah.
yeah, so if you forward him my number, then sometime tomorrow afternoon, or afternoon or late evening, I'll give him a FaceTime just to see how things are. That might help. I don't know. Like I thought maybe a quick call of 5-10 minutes that might
Okay.
help. Yeah,
Thank you so much, doctor. Thank you so
sure.
much. Let him know. He's sent thank you on my WhatsApp. Thank you.
And I think Prashant was here. I'm not sure. Prashant is
Yeah,
there.
he's jumping out and jumping in.
No,
Okay.
I
Couple of times.
Oh,
I
you're
took.
there.
I
Okay.
mean, I could make Mr. Mekela Malaki. Anyways, you're giving good information, so
Right, right.
you want
So,
to,
so
yeah.
Prashant is also our well-renowned doctor as well. So he will also, like, if I think he might help you as well, depending upon his availability. So
Absolutely, anytime. If anybody have any questions, if they can put in the group or they just straight away throw me a message. Anyways, I'm off for last next few days, so anyone has any questions, because there will be a lot of anxiety. Even can I just share a
yes, yes,
quick?
Prashant. Yes, yes. Please feel free.
So actually, I was in on call last night, and I came across a patient who actually works in our hospital, and she got COVID infection, and basically she had all the testing done. So we sent her home basically, and just asked her to self-isolate because she was clinically well. As Weber said, there are a few markers. We decide who needs to stay and who can manage at home. So basically, she got really anxious because because of this whole social media things going on, and she was thinking like she getting really trouble with her breathing. So basically, she just called 111, and she ended up coming to the hospital. So again, we did all the testing, and everything was pretty normal. So I ended up telling her like, definitely don't need to stay in a hospital because you quite well. But the anxiety and panicky city actually made things worse. So she started getting some pain somewhere. So this is very common to be a panic and anxious about symptoms. So as I think Annie mentioned the question about having a spot in a back of throat and you worried about something wrong. But I think as Weber said, there could be a lot of different reasons. It shouldn't be not related to just a COVID infection. There are a lot of secondary bacterial infection we can cause this. We have glands around our throat which kind of are police. Basically any infection try to stay in, basically they get swollen and bigger. So this is just kind of a process of infection, and if they're really causing pain, so ideally paracetamol or gargles, these are kind of our soothing treatment, basically trying to reduce the pain. But once your body immunity take over strongly, this infection should clear from the system. So just wanted to add those points. But yeah, I'll make comment in between.
Mhm. All right. Any specific questions?
Yeah, just a quick Lalit here. So
Hello.
when you have this infection at the back of the throat, or the chest X-rays you showed the other day, I mean they're not prescribing any antibiotics, huh? I mean it's an infection.
Yeah,
Uh,
so, regarding the role of so we are giving antibiotics to those who are staying in the wards, or if they need to go to ICU and they are becoming clinically too much unwell, then they will get a specific normal antibiotics which we give. Uh, as a normal empiric uh, treatment of antibiotic, it is subjective. That if the clinician thinks that will benefit you from getting secondary bacterial infections, or that will help to ease off the infection, so it is a clinician's decision, to be honest. So say for example, if there are certain chest x-ray changes, so if I give the antibiotics, then not necessarily my other colleague might be having the same school of thought. See, he might have a different stake on it. In ideal world, we all learn from the same books, so we should have the same opinion. But sometime, in some cases, some might say, like Prashant might say, like, no, we need to give antibiotic, and I'll say, no, I don't think so, or either way, vice versa. So, but if there is obvious developing like big pneumonia, big pleural effusion, then yes, then both will agree, yeah, we need to give the antibiotics. So
Yeah,
it is a subjective one. In
sure.
cases of tonsillitis specifically, so if it's so in children we have what we call as center criteria. So when there is a like there are different components of it when you need to decide to give antibiotic. In adult, we do tend to give antibiotic if we clinically feel. But again, like that was my main concern earlier as well. That fever and cough, we are asking people to stay at home, but there may be n number of other things which can happen, which can mimic like it, but we should not neglect those things. So probably I think the only way around it is either you have a big telemedicine facility available where the experts are giving that advice with a guarded it's a guarded advice. It's not a complete diagnosis or not complete treatment options on phone, but at least they will guide you basically. So that's what I'm started doing from tomorrow, as FaceTime. I think maybe it will be quick. It's not a detailed one, just to support. Although there were some commercial people were trying to do that, but I think there are a lot of other litigations in the commercial aspect of it. But as a friend or family giving an advice should be all right, I think.
Yeah, that'll be great, Vaibhav.
Yeah,
Thank you so much. That'll be really nice.
Mhm. What
thanks.
do you say, Prashant? So I think you're on mute.
Oh, sorry,
Mhm.
didn't realize it.
Yeah.
So definitely, there is antibiotic doesn't have role in COVID infection, even though US has different view on it, even though the FDA hasn't approved the treatment. It is not licensed, uh, but it is the drug they're using in terms of hydroxychloroquine and the azithromycin only for people who are really, really unwell and they are tubed and they're trying to see whether that makes some difference. But uh, in NHS or even most of the healthcare system, antibiotic doesn't have role to treat this infection, and this is viral infection. So antibiotics are antibacterial, so they basically don't have much role in. So unless there is a suspicious you developing secondary infections, like if you're coughing, and the simple way to know whether you having bacterial infection is see the color of your flame. So when you cough, if you're getting greenish, yellowish color, rusty brownish color, so that tells you like it is now getting secondary bacterial infection. Again, is depend on how physically you are, how uh, problems you have background in terms of if you have COPD. People are smokers, people have asthma, they have some lung damage, so their protection is a bit less when their lungs can't function properly. So in those cases, we do advise to give antibiotics, but not each and everyone need antibiotics. But just want to clarify, the antibiotics are for bacterial infection. It is not for COVID infection. So simple symptomatic treatment usually is enough to keep your symptom under control. And if they're minor, we expect they will get better as like the other flu infections, like influenza virus, which is again pretty common at the moment. So even you feel you're getting dry coughs, runny nose. It could be a common regular flu. So yeah.
Well,
Uh, Dr.
also on top
Prashant,
of
sorry.
so,
Dr. Prashant, just also came across one thing about the US. You mentioned about erythromycin. The one thing they mentioned about like hydrochloroquine, sulfate, zinc, and Z-Pack. So which is treated almost 700 patient with a 100% success rate. So is that like possibility tried only in US or is it across the world?
Uh, as I said, these drugs are not licensed to use for this condition. So usually, when somebody claims that these drugs are effective, we have to look into the studies, what kind of patient they have, what kind of there is a stratification of the patients so there are studies been developed, and then they look into the drug whether it's effective. So people can claim, unfortunately, that this can treat this problem, this can treat, but we don't depend on those. Basically, in medical field, we depend on the studies and the trials and their results, and even we need to look into the results, how much they were effective. And when you select the patient, is again that's the biggest problem, because many studies happens around the world, and they're not, doesn't mean like they are really effective, because we need to see the what kind of patient they've been used. So if you have like 100 patients which are just having a minor symptoms, which anyways without treatment you expected they will get better. But if you think like they coming to me and I say like this is the treatment works, and I believe just because what I learned from somewhere else, and I say
Right.
like this is the treatment I'm going to use it, so they might get better even though without treatment. So again, claiming things are might got easier at the moment, but as Weber said, NHS also depend on evidence-based medicine. So if there is no evidence about this, and so far the studies have shown there is no real benefit using those drugs, and people are claiming. But I seen somebody uploaded that some article, but yeah, it's individual thing, and it's not licensed drug, so nobody knows basically how effective it is. And again, there have been cases people had trouble. One patient died basically because of this. So using those drugs are mostly the hydroxychloroquine drug is commonly used in connective tissue disorders, which is like rheumatoid arthritis and some other very high inflammatory process in which they damages the joint. So to reduce that inflammation, this hydroxychloroquine drug used, and they thought like this similar mechanism will work if you get really bad infection in your lungs and then you can't breathe. uh, Again, there's no clear
So
benefit.
there is like again as we discussed yesterday as well, like different people have different school of thoughts and they found things differently. Some people think that the chloroquine has immunomodulator action, so it increases the immunity up to certain extent. So the papers which were published in China, they found that in vitro, that means outside the body, when they tried the medication with a virus and like did different studies, they found that it helps to break down the virus on a quicker basis. So I think it depends upon how you practice. So whether to it is again in an individual choice. So say for example if somebody is so say for example if somebody is under my treatment, and if they're in ventilator, and if not if they're not getting better, I'll try to give them the other options available in the market, like giving the antiviral and antibacterial chloroquine, and see whether it works for them or not. But there is ethics. The ethics might vary from country to country as well. In UK, there is a strict protocol, strict guidelines about using the medications and for antibiotic resistance and different. But at what cost? That's quite debatable.
Makes sense, doctor. Thank you.
Yeah.
So Vaibhav, we have a
Yes,
time
I
check. We
think.
have 5 minutes more.
Yes,
So
yes,
I
yes.
think so. This is good for today's call.
Yeah,
While the whole purpose of the call was just to not advise any much more, but just take precautions, take care, stay indoors, stay safe.
yeah,
And parting statement before we close this call is the recordings for yesterday's respiratory discussion with Dr. Vijay Joshi also has been uploaded to Vaibhav's YouTube channel UK Saver. So anybody who's interested can go back to YouTube and subscribe so that you'll get updates when the videos are getting uploaded. And this, it takes 24 hours. So this video, this call that we had today, that video also will be uploaded in the next 24 hours.
yeah,
So saying that, I think so we should be good, stay
yeah.
indoors, stay safe, and good enough to close this call. So thank you all for joining this call. Appreciate it.
And take care. And we'll have some different topic tomorrow.
Tomorrow.
And on Thursday, Dr. Puranik is expressed that he most likely will be able to join. He's one of the anesthetic consultant, so he's looking after the ITU as well. So he most likely gonna join on Thursday as well. So there are a lot of good lectures or series coming through the next couple of days. So stay tuned and like, share, and subscribe. And take care.
Thanks, doctor. Thanks a lot.
Thanks,
Take
Vaibhav.
care.
Thanks, Prashant. Thanks,
Thank
Anand.
you.
Really
Thanks a lot.
Bye
Thanks,
bye.
Deshpa.
You
Bye.
should do at the end like with a small video, likes, share, and subscribes.
Sure.
cheers.
Okay.
Bye.
Thank you
Take
very
care.
much once
Good
again.
night.
Thank
Good
Stay
you.
night.
safe, guys. Stay safe. Yeah.
Bye.
Bye.